Hello, my name is Andrew Gonzalez, and I'm a general surgery resident and health services researcher. I'd like to thank Google and MedTech Boston for sponsoring this Google Glass Challenge. In the next few minutes, I'm going to introduce an idea for using Google Glass to streamline the triage of acute stroke patients. Why do we care about acute stroke so much? Well, each year, 800,000 Americans suffers an acute stroke, making it the fourth leading cause of mortality, as well as a major source of acute and chronic disability. Strokes cost the United States $74 billion per year. So how can glass improve stroke care? Well, achieving optimal post-stroke outcomes is essentially a function of time. First, you have to diagnose the stroke, which involves ruling out the myriad clinical entities which have similar signs and symptoms. Second, you have to classify whether or not the stroke is ischemic or hemorrhagic, because giving clot-busting thrombolytics such as TPA are the treatment of choice for blockages due to ischemic strokes, but will make brain bleeding worse in hemorrhagic strokes. Finally, although there is a 3 to 4.5 hour window when patients may be candidates for TPA, outcomes are best if the medication is given within the first hour after arriving to the emergency room. So what's my idea to improve care? Essentially, I want to use Google Glass to optimize ambulance time. Specifically, while the ambulance is en route to the hospital, an EMT wearing Google Glass can initiate a hangout with the emergency medicine physician in the ER. This will allow that physician to do a brief history as well as an NIH stroke scale, which is a 13-point assessment that allows risk stratification and assists with the decision of whether or not to give TPA. The goal is to reduce in-hospital delays while maintaining continuity of care, because the treating physician in the ER has already seen and performed a brief exam on the patient before the patient has even arrived to the hospital. It is of paramount importance to reduce delays as much as possible, because every minute of ischemic time results in 2 million neurons being lost. So how are we doing so far? Well, on average, even among the best centers, only 30% of patients get door-to-needle times of less than an hour. Doing a quick back-of-the-envelope calculation, if there are 800,000 stroke patients, 80% of whom are ischemic and 70% of whom don't get TPA within the first hour, we have the potential to improve care for nearly 500,000 patients. My business plan is 3 phases. The first would be a proof of concept in real-world patients. Mainly, we need to know that the technical capabilities of glass are good enough to pick up physical exam findings in the setting of strokes. The ideal model to use would be to look at documentation of post-stroke rehab progress using Google Glass. The second phase would be to train and certify hospitals and providers in the use of this telepresence technology. In the third phase, we would initiate a quality improvement collaborative. Prior studies have shown that collaboratives such as the National Surgical Quality Improvement Program have improved outcomes for surgical patients. Similar to that collaborative, we would be using a fee-based membership model. Hospitals and health systems have a significant market-based incentive to invest in programs such as mine, which could improve the quality of care for their patients. Further, some of these costs would be passed on to insurance companies because, owing to changes in the Affordable Care Act, many companies now are responsible for an increasing share of the care of their patients. Finally, because 75% of strokes occur in patients over the age of 65, Medicare is already on tap for taking care of their initial episode of care as well as post-discharge rehabilitation needs. In conclusion, Google Glass may be useful in facilitating faster triage of stroke patients because it is a wearable, hands-free, real-time video conferencing device, which permits EMTs and emergency medicine physicians to perform a history and NIH stroke scale prior to the patient ever arriving to the hospital. Thank you very much. Please feel free to contact me. Otherwise, I'll see you in Boston on Wednesday.